Good day, my name is Neil DeVete. I'm one of the medical officers of health for the Bay of Plenty and Lakes DHB areas. I've just been asked to talk a little bit about the health effects or potential health effects related to this event. The most important one, obviously, is the fact that we're going to have oil washing up on our beaches. We have had for the last couple of days. It will continue over a number of weeks, no doubt. What we are advising the public is that they stay away from the beaches, avoid direct contact with the oil. The easiest way to prevent any health effects is to stay away and avoid contact. Some of the health effects include with direct skin contact, rashes or allergic reactions. Most of these are going to be quite minor. If it gets into the eyes, that can be quite irritating as well. What we're advising is if someone is inadvertently exposed, that they wash the oil off with soap or water or one of the proprietary hand cleaners and not use any agents that might be dangerous in themselves. And if they get oil in their eyes, to rinse them out with water for 15 minutes. And if there are any persistent symptoms, to see their GP. Most of the effects on humans, if any, are going to be minor. This is something that's obviously a much greater concern for wildlife. The human health effects, especially people who avoid direct contact, are not likely to be significant. People have also been concerned about the fumes and the smell of oil. As it comes ashore, you might get fumes perhaps for an hour or two that would dissipate. We would advise people just to move away from the area if they can. If they need to be indoors, closing the windows and shutting the doors would help. These fumes are likely to dissipate reasonably rapidly. If anyone does have any sort of ongoing health concerns, we are advising them to contact Healthline, for example. So the key messages are really avoid it. If you do inadvertently get contaminated in some way, clean it off with soap and water. And if there are any persistent symptoms, do get some medical advice. Most of the effects are unlikely to be significant. We have put in place a process of notification. So if any members of the public present to a medical practice or a GP with any oil-related presentation or health effect, we will be notified of that. To date, we have had no notifications of any significant effects among the public, and we'll continue to monitor that situation. We are also advising people not to swim and not to collect shellfish in areas that are visibly contaminated with oil or where we have put up signage advising people that the beach has been contaminated with oil. And we'll continue to monitor that situation as it evolves over the coming weeks.